In 2025, your UK maternal rights are clearly defined. Even so, many women have their rights and choices ignored entirely, and legal actions against the NHS for maternity errors have doubled. This shows a dangerous gap between your rights and the care you might get. We'll break down your rights, show why they fail, and how advocacy protects you. First, what are the key rights every pregnant person in the UK is entitled to? Every pregnant employee gets 52 weeks of statutory maternity leave. This applies from day one of your employment, no matter how long you've worked there. You also have the right to paid time off for all antenatal appointments, which can include medical checkups and even doctor-recommended parenting classes. For 2025, statutory maternity pay has increased to £187.18 per week. Parents of babies needing neonatal care now get up to 12 extra weeks of leave. And if your job is at risk, you now have priority for other roles during redundancy. These aren't just workplace policies. They are backed by powerful UK laws. So, what are the legal pillars protecting you? The first pillar is the Equality Act 2010. This makes it illegal to discriminate against you for being pregnant, from unfair dismissal to being denied a promotion. The second, more fundamental pillar is the Human Rights Act 1998. This guarantees your right to make your own choices about your care and to be treated with dignity. Within this, Article 2 protects your right to life. This means you are entitled to basic life-saving health services, including all necessary maternity care. And Article 8 gives you the right to bodily autonomy. This means no medical procedure can be performed without your informed consent. Your yes or no is final. With such powerful legal protections for consent and safety, why are things still going so horribly wrong? The answer is rising medical negligence. Families now file a record 1,400 legal actions a year because their rights to safe care were violated. The financial impact on the NHS is staggering. Since 2019, the potential bill for maternity negligence claims in England has reached over £27 billion. That's more than the entire NHS budget for newborns over the same period. This isn't just money. It's a symptom of a system under immense strain. The financial cost points to a deeper crisis. But who is bearing the highest human cost of these systemic failures? Recall the statistic from the beginning. These risks are not distributed equally across the population. UK data shows black women are 4 times more likely to die during pregnancy and childbirth than white women. 4 times. The disparity continues. Women of Asian and mixed race heritage face double the risk compared to white women, pointing to deep-seated issues of inequitable care. This is a systemic pattern. It means for some, the need to actively advocate for their own safety and rights is significantly higher. So when your fundamental human rights meet systemic risk, what is the bridge that ensures your safety? The bridge is medical advocacy. It is the active process of making sure your voice is heard and your rights are respected. Think back to your right to bodily autonomy under the Human Rights Act. Now, place it in the context of the systemic risks and biases we've just seen. Advocacy is what activates that right. It's having the support to make sure your consent is truly informed and your concerns are taken seriously. You are not alone in this. Organisations like Maternity Action exist to protect these rights. And clinics like Doctors of the World give direct advocacy to help vulnerable women manage the healthcare system. In 2025, your maternal rights are strong, but they are not self-enforcing. Knowing your rights is the first step. Making sure they are respected is the challenge. Protect yourself with advocacy. Document your preferences, ask questions until you are satisfied, and never hesitate to request a second opinion. Bring a partner, friend, or doula to appointments as your advocate, someone who knows your wishes and can speak for you if you cannot. Share this video to empower others with this information. Find links to advocacy groups and resources in the description below.